Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. If you are just joining us, we are talking about chickenpox and shingles. Let's get to our viewers' questions. Our first question comes to us from Diana from the village of Barrigada. She asks, my son has a slight fever, runny nose, and a skin rash. How will I know if he has chickenpox?
Oh. Well, you know, the rash of chickenpox is pretty characteristic. It comes in crops, little crops of red bumps that turn into blisters, and they evolve over time. So you'll have some that are little blisters, some that are bumps, some that are scabs already, and along with that, they're really very itchy. So it's usually pretty easy to figure it out, but if you need help, we'll be glad to take a look.
Now, our next question comes from Laura, who is from the village of Chalampago. She asks, how can I prevent my child from scratching the bumps?
Yeah, that is really difficult. I often say that, you know, telling somebody to scratch is kind of like telling them not to blink. It's really difficult not to do that because the itch is very powerful. But you can give your child Benadryl. That kind of reduces itch a little bit. The typical thing that people use to dry up the blisters is Calamine lotion. You put that on, and it's sort of like a thing that makes the wet blisters dry up and scab up more quickly. Just coaching them, clipping off their fingernails so they're short, so that at least if they scratch, they won't infect their sores. But it's very challenging. Another way would be to teach your child to rub rather than scratch. Use some lotion and rub it rather than digging at it.
John from Agania Heights asks, my child got chickenpox from another kid at school. How long will she be contagious?
Right. So actually from about 1 to 2 weeks is typical. It can extend up to 3 weeks. Usually 1 to 2 weeks is standard.
Okay. And now Patricia from the village of Jornia, she asks, I had chickenpox when I was a kid, and I've developed a rash on one side of my body, and I have tingling. Is this shingles?
Yes, it is. And funny enough, sometimes the tingling feeling, the pain will actually come before the rash, and it can affect, again, any part of the body. And there have been cases where, you know, the pain is so severe that people have actually ended up with surgery or explorative surgery or tests done to try to look for the cause of pain, where it's actually nerve pain. And so yeah, it sounds like shingles. The rash, if it's treated within the first 72 hours with pills, can be controlled much better. So instead of lasting for 6 weeks, it will last about 2. So if you think you're getting the shingles, you should get right into the doctor to get a prescription.
Okay. Ray from Tetedo, he asks, is Calamine lotion good to use for chickenpox?
Yeah. Just as we mentioned, Calamine lotion does dry up the spots. It doesn't cure it. It doesn't stop the spread of it, but it just helps for comfort.
Ken from Talafofo, he asks, is it true shingles normally occurs in people over 50?
More commonly, but I've seen children with shingles many, many times. So any age group can have it as long as they've had chickenpox earlier. But as we get older, we tend to get a little weaker. Our immune system will be more or less strong. And so shingles tends to be a disease that affects older people, especially after the age of 60.
Okay, here's an interesting question. This is from Sean from Tamuning. Since I had chickenpox when I was a child, can I prevent getting shingles?
Well, you can't prevent it 100%, but you could get the Zostavax vaccination, and that would kind of boost your immunity so that you'd be less likely to get the shingles. And again, because we mentioned that shingles is a disease of a weakened immune system, or a consequence of that, then keeping yourself strong and healthy, making sure you get enough sleep and not getting too stressed out, taking care of your health is really important.
All right. Well, thank you so much, and happy holidays.
Happy holidays.
Again, thanks for coming in and sharing your advice and medical expertise. Dr. Lom will be back again next week to talk about COPD, chronic obstructive pulmonary disease, and emphysema. If you have a question, send it to healthyliving@kuam.com or post a question on the KUAM News Facebook page. We're back to wrap up the show after this. Stay tuned.